Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about heat stroke, vehicular heat stroke, and our special guest is Nancy Boyd with Safe Kids Frederick. Nancy, welcome and thank you for joining us.
And thank you for having me join you. I'm happy to be here.
Well, great. Well, let's just jump right in. So what is vehicular heat stroke?
Vehicular heat stroke happens when a body gets overheated in a car, in a vehicle. And it is the most dangerous type of heat stroke, can cause organ damage, even death, and is definitely an emergency medical situation.
All right. Well, and are there some individuals or situations or I guess persons who are at most risk?
There are three groups of creatures that have difficulty maintaining body temperature, and that are our children, the elderly, and our pets. Our children, their body temperature can increase 3 to 5 times faster than adults. And so we really need to be concerned about them in the vehicle.
Wow, that's something else. So children, so that sounds like such a significant statistic or fact there. So children's body temperatures can rise, did you say up to three times?
3 to 5 times faster than an adult's.
Wow, wow.
And so at an 80-degree day, their temperature can, in 10 minutes, rise to a dangerous level.
Wow, in just 10 minutes. Well, so yeah, so you reminded me of something that I suspect is a myth, that I've heard people say, oh, it's not really hot outside. I don't need to be worried about heat stroke in the car.
The lowest temperature that a heat stroke death has occurred at was when the outside temperature was 57 degrees.
Wow.
Within the first hour, a child's temperature can increase 45 to 50 degrees in temperature.
Wow, so that's
from the outside temperature.
So the outside temperature can still be relatively cool, but the inside can go up to 40 to 50 degrees higher than the outside temperature.
Right.
Okay. All right, well that sounds very important for people to remember, because I suspect a lot of people just aren't aware of how hot it can really get in a car, especially on a day when it's cold out in the wintertime maybe even.
I think that's true. And a lot of people think that it only happens in really hot areas of the country, but it can happen anywhere.
Okay, so what can people do to reduce the risk or the likelihood of heat stroke in a car?
We want to use the acronym ACT, A-C-T. So A is we want to avoid leaving a child in the vehicle for even a few minutes. And cracking the windows does not help, does not prevent that from happening. And we want to make sure that the car is locked so that children can't get into vehicles unattended. Say the car is sitting in the driveway and we don't want them to get into the vehicle that way. So our key fobs also that can open doors easily, we want to keep those out of reach of small children as well. So that's the first step, to avoid those possibilities. And then we want to create reminders that the child is in the vehicle. And statistically, 53% of the children that have died of heat stroke have been because the parent has forgotten that the child was there. And usually it's because their routine has changed. It's not the normal routine. Dad's taking the child to childcare in the morning instead of mom, who usually does it. And so their routine is altered. And our minds are so full of everything that sometimes we all go on autopilot. We're expecting to go to work, but that day we're supposed to take a different route, and our minds just go on this autopilot, and we go to work anyway, and we end up not going to where we're supposed to be going. So, and then oftentimes a child falls asleep in the car.
Right.
And then they're not telling you that they're there, and you just forget. So we need to create reminders, putting something that you have to have when you get to work in the back seat where the child is. Even if it means taking your left shoe off and putting that back there, but putting your cell phone or your tablet or laptop or your pocketbook, anything that you would have to take to work in the back seat. Putting something of the child's in the front seat to remind you. Making an arrangement with your child care center that if you're not bringing the child, you will call and let them know that the child's not coming that day. And if the child doesn't arrive by the typical time they usually do, that they will call you and ask what's the problem. So anything that we can do to remind us that that child is in the back seat. And then T, the last step, is to take action. If we see a child in a vehicle, then we want to call 911 immediately.
Okay, well, that is good information because you already anticipated the other questions I was going to ask, which is what steps can parents take to avoid forgetting that their children are in the car? And then so you gave some really good practical tips. I especially like the one of taking off the shoe because that I'm pretty sure I'd recognize that I didn't have my shoe on pretty quickly. The one about not having my bag or purse, that I might just think, oh, it's a much lighter walk into work. But
yeah, if you
but the
step
shoe,
out into the ground,
I would remember that, especially in the wintertime.
Right. Or if it's wet out.
Right. And then so the other part about what should people do, that T for take action if they notice a child who's unattended in a car.
Yes.
Or a dependent adult or an animal,
right,
too, I guess.
And we have window clings that are available through the health department that can help you, remind you that the child is there. And we have other little labels, stickers, the 8 steps to remind you that children, so that you don't forget that the child is in the vehicle. 8 reminders.
Okay, well, great. Well, I hope that people will have learned something from this, will definitely take action and talk to others about it too so that they're aware about how quickly the temperature can rise and how inside vehicles, even when it's a relatively cool day out, and then also that children's bodies, that their temperatures rise much faster than adults, and that there are reminders people can, some things that people can do to try to remind them, and we also have the window clings and some other the 8 steps that you mentioned available at the health department.
Right.
Great. Well, thank you very much for being a guest on our show today.
You're very welcome.
And now please stay tuned for this month's Medical Myths.
This public service announcement is brought to you by the Special Delivery Program of the Frederick County Health Department. As summer heats up, protect Frederick's children by having them avoid heat stroke-related injury and death. Never leave your child alone in a vehicle, even for a minute. Keep your vehicle locked so no child can wander in. Create reminders by placing your cell phone, bag, or even your shoe beside the car seat, especially if you're not following your normal routine. If you see a child alone in a vehicle, take action. Call 911. One call could save a life.
Are you a fan of Facebook? Hooked on Twitter? Now you can stay connected to County Executive Jan Gardner using your favorite social media platforms. Like, follow, and subscribe today.
Frederick County's GIS team has updated the popular At-A-Glance online mapping tool that puts all kinds of information at your fingertips. A new menu as you enter the program provides a user-friendly guide to what's available with large, easy-to-read icons. Just enter your address, zoom to your property, and have useful data about schools, zoning, libraries, parks, and much more. With a click of your mouse, fast and convenient search functions allow you to get your recycling schedule, find out assessment and property taxes, and discover crime statistics. To access the program, simply go to the Frederick County Government website, frederickcountymd.gov/at-a-glance.
And now here's this month's Medical Myth. This month's Medical Myths is about teen prescription drug abuse from the Medicine Abuse Project. Your teen is hopefully smart enough to avoid abusing prescription drugs, but chances are your child may not have a friend who may not be. Nearly 1 in 4 teens, or 23%, report taking a prescription drug not prescribed to them by a doctor at least once in their lives. Many teens are unaware of the dangerous risks of prescription drug abuse. Some common misconceptions and the facts about prescription drugs include the myth that prescription painkillers, even if they are not prescribed by a doctor, are not addictive. Well, the fact is that prescription painkillers act on the same site in the brain as heroin and can be addictive. Another myth is that there is nothing wrong with using prescription drugs without a doctor's consent. The fact is that taking prescription medicine that your doctor didn't prescribe and doesn't know about can be harmful, especially if it is mixed with other drugs prescribed for you or alcohol. The final myth today is that if a prescription drug is legal and widely available, it must be safe. The fact is that prescription drugs are safest when used correctly under a doctor's supervision. But taking prescription drugs that aren't intended for you, taking them for reasons other than what they were prescribed, and taking amounts more than what was prescribed, and/or mixing them with alcohol or illicit drugs can result in potentially deadly consequences. If abused, some medications can slow breathing, cause an irregular heartbeat, be addictive, and even kill. In Frederick, drug and alcohol intoxication deaths reached the highest number ever in 2014. Please properly dispose of any unused medicines in the drug disposal boxes located throughout the county, and lock up medicines that are currently located in your medicine cabinet so that visitors won't be able to access them. If you or a friend or family member are misusing or abusing prescription medications or cold medicines, please reach out and get help. You can dial 211 locally for more information and resources. That's this month's Medical Myth. And now, here is this month's health tip with Amber Nally.
Hello, this is Amber Nally, health educator with the Frederick County Health Department. This month's health tip is brought to you by Frederick County Infants and Toddlers Program. How your child plays, learns, speaks, and acts offers important clues about your child's development. Developmental milestones are things that most children can do by a certain age. The Centers for Disease Control and Prevention recommends that parents check the milestones your child has reached by his or her first birthday. At 1 year of age, most children are well on their way to developing language skills and are beginning to use words. At 1 year, your child may respond to simple spoken requests, use simple gestures like shaking your head no or waving bye, make sounds with changes in tone, say mama and dada, and exclamations like uh-oh, and try to say words you say. Knowing speech developmental milestones can help parents act early to prevent or correct developmental delays. Check your child's ability to hear and pay attention to ear problems and infections, especially when they are reoccurring. Reinforce your child's attempts to talk by looking at him or her, speaking, and imitating his or her sounds. Teach your baby to imitate actions such as peekaboo, clapping, and waving bye-bye. Talk about what you are doing, where you are going, and what you will see. Tell your child's doctor or nurse if you notice signs that your child is not talking or responding to you. The Frederick County Infants and Toddlers Program here at the Frederick County Health Department is ready to help you if you have concerns about your child's development. Call us at 301-600-1612 for more information or to make a referral. All of our developmental services are provided at no cost to families and focus not only on your child, but also on helping you help your child through everyday routine and activities. For more information regarding speech and language development in children, please see the CDC's developmental page. Thank you for tuning in to this month's health tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.